Okay, guys, it is 11/20/2020. It's Friday. We completed our our test for aerosol and humidity, CPT, all of those airway clearance devices and modalities on yesterday. We did the lab and the exam. Okay, if class did really well on the exam. If you did not pass the exam, make sure over the weekend you do the PNR for aerosol and humidity, which will be put on into the Canvas on this evening. I'm going to get started today with pharmacology. We will cover a few things. Won't get really deep, but we will cover a nice little amount of material. I definitely want to get you on the dose calculations. I'm thinking about if I'm gonna get to that today. I may or may not. A lot of people have a problem or a thought when you think about pharmacology, you think about, I can't do, milligrams to cc's, and how many milligrams is it if I pull 3 cc's out of my syringe, or if I have 2 cc's of a 5% solution, how many milligrams is that? And, when I first learned it, I hated the thought of it, okay? But I have a drug dose calculations trick that will solve your issues for that once and for all, okay? You'll be running around your house in the medicine cabinet trying to figure these out yourself, and because it's good to know, okay? Because sometimes when you get those droppers, it might say give a certain amount of teaspoons or give a certain amount of cc's of something, and then it's like, well, this don't say cc's, this says milligrams, or this is milliliters, or something like that. I'm not sure of what am I supposed to do. But now you will be able to calculate that, because as respiratory therapists, we give medications in certain degrees, right? Percent solutions. We have a 5% solution, or a 9% solution, or a 0.5% solution, and you'll have to turn that into milligrams. And there's a formula that you will learn that will solve all of your woes on drug dose calculations, because you got to know, how much did you give that patient? Because you're going to learn that what we give can affect the sympathetic nervous system and the parasympathetic nervous system. I'm sure you've heard of the term fight or flight before. You get back in the corner, your adrenaline goes up, heart rate goes up, you're ready to fight or die, right? Or run. And so that is the sympathetic nervous system that has been enacted. Well, you're going to also learn that when that sympathetic nervous system is enacted, not only are you ready to fight or flight, but your airway can go from this to this, okay? When we have the sympathetic nervous system, when it is activated, it gives bronchodilation, all right? Bronchodilation. So that's a good thing, right? You can be sitting at normal tone. This is our airway, and it can be sitting at normal tone. This is how it should look, right? About like this. And then whatever reaction happens, like say asthma attack or hyper-responsive airways. Remember we talked about that with the bland water aerosols getting inhaled, irritants, anything like that can cause a bronchospasm. And that is when your bronchioles close like this. And what you see, this yellow, is secretions, right? This will be secretions oozing in your airway. And so if it's constricted like this, you start to hear the wheezing sound, right? A high-pitched rhonchi are wheezes. When they're breathing, that's because air is going through a small airway or orifice, right? So then how do we get rid of that? Well, we give albuterol. I'm sure everybody's heard of albuterol, which is only one of many bronchodilator drugs. And what they are sympathomimetic or adrenergic bronchodilators, because they act on the sympathetic nervous system, also known as the adrenergic nervous system, okay? Adrenergic is short for adrenaline, right? Adrenaline, adrenergic. That's all of that fight or flight. You're backed into the corner, your senses are heightened, your pupils dilate, your nose is smelling better, your heart rate goes up, respiratory rate goes up, your blood pressure goes up because it's anticipating blood loss. If I'm fight or flight, I might get stabbed or hurt and it might start bleeding. So the pressure is already up, anticipating this action. Because I told you, the body wants to live no matter if you do or not, okay? And so not only does that happen, what your bronchioles are open wide up because they got to get oxygen. Your body's trying to say, okay, we're about to die, we're about to fight or die, so let's pump more blood, let's get more oxygen, let's get more air going, let's get our bronchioles wide open for what's about to happen, okay? And so we have come up with drugs that simulate that, even if there's no issue, right? If there's no issue, you're not scared, but if you have an asthma attack and you become bronchodilated, bronchoconstricted, we can give you a drug that will mimic the sympathetic nervous system, which will open you up, which is bronchodilation. Bronchoconstriction, bronchodilation. And this is normal tone. Okay, so you have normal tone, bronchoconstriction, and bronchodilation. Normal tone, bronchoconstriction from a disease or asthma attack. We give medicines which are called adrenergic bronchodilators that will bronchodilate you. Now, there are some side effects with this because what else you think's happening? Not only is the albuterol opening you up, but now he's got you all jittery, right? You're ready to go. You're ready to fight. Your blood pressure can go up. Heart rate can shoot up because it's mimicking the sympathetic nervous system, okay? And there's another part of the central peripheral nervous system is broken down into two parts, sympathetic and parasympathetic. Just talked about some of the sympathetic attributes, okay? But on the other side is the parasympathetic nervous system, and it causes constriction, okay? The parasympathetic nervous system can cause constriction when the acetylcholine is activated in the body. So you're gonna learn which side has which neurotransmitter that causes these effects. On the sympathetic side, we use norepinephrine, or epinephrine is the neurotransmitter for the sympathetic nervous system side. That neurotransmitter of epinephrine, when it gets to dripping in the brain, it causes bronchodilation, heart rate, you're ready to fight or flight, right? And on the parasympathetic side, we have what's called acetylcholine. Acetylcholine is also known as the cholinergic side, okay? Acetylcholine, cholinergic, all right? And on that side, that's the feed or breathe. We just want to relax. We can constrict the bronchioles down. We can make the pupils go back down. Heart rate goes down, right? We just want to feed or breathe. That's what it's called, feed or breathe. So we either want to eat, relax, have sex, reproduce, relax. That is the parasympathetic nervous system side. So what if the acetylcholine is causing a constriction, right? Well, we can say, okay, what kind of drug would we use to block the effects of acetylcholine? Okay, we don't want that to happen, so we can block acetylcholine from causing this with a drug. And those drugs are called anti-cholinergics, because the parasympathetic system side, which can cause constriction, is known as the cholinergic effect, or the cholinergic nervous side, right? And if that's the case, I want to find a medicine that will block the cholinergic response, and that medicine is called anti-cholinergics, okay? So you got sympathomimetic drugs that bronchodilate, or also known as adrenergic drugs, right? Because they're on the sympathetic nervous system side. And then we have anti-cholinergic drugs that block the effects of acetylcholine, which is the cholinergic effect, okay? Just want to give you that framework before we jump into the lesson plan, so you'll understand what these terms mean when we get to them, okay? On pharmacology, you are required to do at least 10 note cards that I have to see, okay? So when you come in to take your exam for pharmacology, and you make sure you bring in your 10 note cards. You're going to want to do way more than 10, but I'm only requiring you to do 10 that I'm going to check, okay? But you need, and you'll learn what you want to do. You'll want, because you have to learn the trade name for drugs. You're going to have to know what the generic name is for that drug, what the dosage is for that drug, what is the side, which nervous system side is that drug, what does it go to, right? Where does it travel in the body and jump on to make bronchodilation or to prevent bronchoconstriction? Where does it do that, right? What part or which receptor sites in the body does that work on, right? So you're gonna have to know all of that for each drug. And so on one side, you might have the generic name, and then on the other side, trade name, dosage, how long I do it, what receptor sites it hits on, all of that, so that you can flash yourself, because in pharmacology, you may have a question that says this drug comes in a 5% solution and is given Q4 hours, and it affects on the beta-1 sites, right? Well, there are several of them that hit on the beta-1 sites, but not all of them have the same dosage, right? So you got to know them all to be able to pick the right drug in the answer, okay? And the answer might be in a trade name, it might be in the generic name. So for instance, acetaminophen. Acetaminophen is a pain reliever, fever reducer, okay? It's usually 325 milligrams. You can get the big on extra strength 500 milligram pills, right? But what is the trade name for acetaminophen? Tylenol. See? So that's how you have to know these respiratory drugs. Acetaminophen is the generic name. Tylenol is the trade name, and what it does and all of that. And that's a real simple one, right? But the ones that you're going to be dealing with are a little more complex. But not only the sympathetic broncho or adrenergic bronchodilators, there's a whole list of them that cause bronchodilation, right? That fight or flight feeling, right? Several of them, right, that you're going to learn about. But not only that, there's a couple parasympathetic side or anti-cholinergics that we use. There are corticosteroid drugs that we use, like Beclovin and Symbicort, Pulmicort, stuff like that. There are some antimicrobials that we use, which are broken down into antibiotics, antivirals, right? Anti-protozoa drugs. There's all kinds of drugs we give as respiratory, not just a little regular breathing treatment to open you up, but we can give you keep you from closing. We got drugs that block phosphodiesterase, which are called xanthines, right? We also have gentamicin and tobramycin that fight gram-negative and gram-positive organisms that may be infecting the body. When that white blood count is 15, 16,000, and there are some secretions locked in one of the segments, patient been coughing up yellow, thick secretions, it's probably infected. And we would go down and get it and see what it is. It's probably Pseudomonas, it could be Staphylococcus, it could be Acinetobacter, it could be all kind of different things. And we would take that, what we learned, right? Take that sample and see if it's sensitive to gentamicin or tobramycin that we give. If it's sensitive to one of those, that's the one that the doctor is going to prescribe, and you as the respiratory therapist will deliver it in a aerosol, okay? And so you got to know that. So those are the things you're going to have to know about pharmacology, all right? And this is the basics or the foundation. When you get to 240, you would do advanced pharmacology, all right? And there will be more of the cardiac drugs. Some of the drugs that you will learn also in ACLS when you get to that in wherever you work. Most hospitals will require you to have ACLS as well as BLS, which is regular CPR. You also have to have advanced cardio life support as well to be employed there. Usually they'll hire you and say you got to get that ACLS in 6 months or you're going to get fired, okay? I teach both of them, ACLS and BLS for Regional 1, and I do it on the side for if the price is right. Okay, so look for me when you get that far. All right, so let's go ahead and get into the Lesson plan. Pharmacology. Some of the objectives. Let me cut this light out. All right. Can everybody see my screen?
Yes.
All right. The student will be able to define a drug, the generic name, chemical name, and brand names, side effect, what is additive, what is dose, what is frequency, and what is duration. Be able to define those. Describe what should be in a prescription, all the things that have to be included in order for the prescription to be valid. You'll be able to calculate percent solutions, okay? That's the drug dose calculations that a lot of people dread before they get to my trick. When they get to my trick, they say, oh, okay, this is how it is. This is easy. Now, I like it now, okay? Describe the path of bronchodilation. I told you we have either parasympathetic or we can go about it another way. Basically, guys, we're trying to accomplish bronchodilation. That's what we want, because most of our patients come, they have asthma attacks, COPD, whatever is causing the airways to close up. We want to achieve bronchodilation, so we can go straight through the door with a adrenergic bronchodilator, excuse me, or we can go in a back door, a window, or some kind of back way to ultimately achieve bronchodilation or enhance bronchodilation. All right? So you're going to have to be able to describe that path. Explain the effects of the alpha, beta 1, and beta 2 receptor sites. Beta 1, beta 2, and alpha are 3 receptor sites of the sympathetic nervous system. When epinephrine is the neurotransmitter, it's the one that's, put it like this. When I say neurotransmitter, I mean the bus driver for that side, okay? The sympathetic nervous system has a bus driver, and the parasympathetic nervous system has a bus driver. It has to get those sides working, okay? Well, on the sympathetic nervous system side, epinephrine is the bus driver, okay? And on the parasympathetic nervous system, acetylcholine is the bus driver, right? So on the sympathetic side, you have 3 receptor sites that bus driver is going to drive to, right? Epinephrine is going to hit 1, 2, or 3 of those sites, okay? And each one of those sites cause a different effect. The alpha stimulation stimulates vasoconstriction, okay? When something has alpha effect, it has vasoconstriction effects. Beta 1, if something hits that beta 1 or steps on that beta 1 receptor, it has increased heart rate or cardiac effect. So heart rate goes up, blood pressure goes up, right? And then beta 2 is the magic. The beta 2 receptor site is the receptor site for bronchodilation. Make sure you know that. The beta 2 receptor site is the site for bronchodilation. So you can imagine when we're trying to look for a drug for an asthma patient, we're looking for a beta 2 agonist, right? We want a drug that has a lot of beta 2 quality so we can get bronchodilation. We don't really need alpha and beta 1. We try to find one that only hits that one. But unfortunately, these medicines hit a little bit of all 3 of them, and you got to try to choose the best one for that patient, okay? Side effects of adrenergic bronchodilators. You're going to have to learn those. I talked about a couple of those. Number 7 is give the trade name, chemical and generic names, concentration, receptor sites acted upon, duration, and dosages for these drugs. These drugs here are the OGs of respiratory: Isoproterenol, Bronchospasm, Albuterol, Vaponephrine, Adrenaline, Albuterol, Terbutaline, Ceravent, Foradil, and Singular. Those are the ones you're going to need to definitely know the chemical and generic names of all of those, the concentration of all of those, the receptor sites that they act on for all of those, and the duration and dosages for all of those. Okay? And not only that, number 8 says you're going to give the indications, dosages, and effects of xanthines, parasympatholytics, steroids, leukotriene inhibitors, and chromium sodium. All right? Number 9, describe the use of distilled water, hypertonic saline, hypotonic saline, isotonic saline, pulmazine, and mucomist. All of those are our mucolytics, right? Those, we talked about a little bit of that. Bland water aerosol, that's distilled water. And then I said we can give hypertonic saline with the ultrasonic nebulizer to induce what? Y'all remember?
What'd you say?
I said number 9 are the mucolytics, the ones that help break down mucus, to move mucus. I said bland aerosols are the distilled water. That water that's coming out of a bland aerosol, that's distilled. But there's also hypertonic saline that if we mix that with the ultrasonic nebulizer is used for what? Sputum what?
Induction.
Induction. Hypertonic saline is really, really salty. Like, it's going to help break it down, and it's used for sputum induction. That's what hypertonic saline is used for. Sputum induction. All right. Then you have hypotonic saline, which is less than normal. Isotonic saline, which is also known as normal saline. Pulmazine and mucomist. And then finally, discuss the delivery systems. How do we get these medicines to the patient? Right? We got MDIs, which are metered dose inhalers. Those little pumpers, or the little handheld pumpers, inhalers, right? I'm sure most of you have seen those before, know what they are. You have dry powder inhalers, which are the same type of thing, but instead of a mist, it's powder that comes out. And of course, the small volume nebulizer, right? The little one we learned that's less than 20 cc's. The small volume nebulizer is what we give for breathing treatments. All right. Here we go. Pharmacology. First thing we're going to talk about is a drug. A drug is anything that exerts a biological effect that is used for treatment, diagnosis, or prevention. Treatment, diagnosis, or prevention. Okay? For instance, if somebody has an asthma attack, we might give them some albuterol. That would be a drug used for treatment. It would be used for treatment in this case. Right? And then let's see. A drug for prevention. Let's see. Let's just say Tums. We can give Tums to either treat heartburn, or we can give it to what? Prevent heartburn. Right? They've got medicines that they say Prilosec, stuff like that. If you know you're going to eat pizza and chili dogs and chili cheese fries and all that, and you know you're going to have indigestion, you might want to pop one of these before you eat to prevent heartburn, right? But what about a drug that's used for diagnosis? Who can think of a drug that may be used for diagnosis, to try to diagnose something?
Like give an antibiotic to see if you have a problem with an infection or something else?
Well, if they give you an antibiotic, it's usually going to be for treatment. We usually don't give you one just to see if you got a disease, because you don't want to do that. But think about what you get here done at school. When you come here to the nurse here at the school, what do they do to you?
Give you a flu shot.
That's not going to diagnose you. That's going to flu shot will be prevention. That's a good one for prevention. It's going to prevent you from getting the flu.
Check the skin test.
TB skin test.
Oh.
TB skin test is a drug that's given subcutaneously. That means under the skin. Right? That's one of our modalities or modes of giving you the medicine is subcutaneous, right? And so we can put it under the skin and see if it reacts. If it reacts, you got TB, okay? So it's a diagnosing tool. So drugs are used for either treatment, diagnosis, or prevention. Now, drugs have a chemical name, a generic name, which are the same. The chemical name and generic name are usually the same, but it also has a trade name. The chemical name is the chemical structure of the drug. Okay, when the chemists make the drugs, it's usually whatever that chemical structure is, that's what they call the chemical name. And usually the generic name is that, right? It's usually that. Acetaminophen is the generic name, and it's probably the chemical name too. I don't know, but the generic name is given by the U.S. Pharmacopoeia. So when you get a test that says what agency gives drugs their generic name, that's the U.S. Pharmacopoeia. Like encyclopedia, it's the U.S. Pharmacopoeia. They will list that drug name into the book, right? There'll never be another drug with that generic name. So it's called the U.S. Pharmacopoeia. They keep up with that. All right. And then the trade name is the brand name or the patented name. Right? So if you come out with a new medicine, they're going to give it a chemical name and a generic name, and they're usually the same. So all you're going to have to know is the generic name and trade name for these drugs, because the chemical name is usually the same as the generic name, okay? So when you come out with a drug, you got a nice little formula that you come up with or came up with, and here's my formula for this drug, right? Well, then you're going to take it to the U.S. Pharmacopoeia, and they're going to name it for you. They're going to give you a generic name, give it a generic name. Because once you have put your trade name on it and you have had monopoly on that drug for, I think, 7 years or 1 year, I don't know, you don't have to know that part, but you have exclusive rights to that drug for a certain amount of time. After that, anybody can take that generic drug and make another drug with their name on it, okay? So for instance, Sildenafil is the generic name for Viagra, okay? When sildenafil was first performed or made, it was made for pulmonary hypertension, okay? Sildenafil was created for pulmonary hypertension, but the side effects were male erection. And so they started to see that these older men or people who have pulmonary hypertension were getting this medicine, and it was causing them to have erections. So they changed the key form of the drug and now trade it or trademark it out there for ED, erectile dysfunction, Viagra, right? So Viagra is still given in the hospital for pulmonary hypertension, all right? You may have a patient who has pulmonary hypertension. That means the pulmonary artery has too much pressure in it, and the right ventricle cannot get the blood to the lungs because the tension or the resistance in the pulmonary artery is so great, okay? So they have a low oxygen sats, right? Because they can't get the blood oxygenated, okay? So they gave sildenafil, which opens up or dilates the pulmonary artery, right? Allowing that blood to flow through without a problem, and then they can oxygenate better, right? But not only was it doing that, it was causing them to have erections. So now Viagra says it's mostly sold or marketed for that. It's still used for pulmonary hypertension, but it's mainly been changed, and Viagra has been marketed for ED. All right. So after Viagra had their run with it, right, now all kind of people can sell the generic sildenafil. So now you have people running around buying the sildenafil, which is the exact same ingredient, but way cheaper, right? It's like having a Nike with no stripe on it. It's the same shoe, right? The exact same shoe, but you can get it so much cheaper when you take the name off of it, okay? So that's the things about the drug. So like albuterol. Albuterol is the generic name for a bronchodilator, and the trade names are Ventolin or Proventil. Ventolin and Proventil are the trade names for albuterol. Okay. All right. Let's look at some other terms. Side effect. A side effect is anything other than the desired effects, right? Anything other than the desired effect. You want it to open you up, but if it gives you a headache, the headache is a side effect. Okay. Half-life. Half-life is the length of time when half of the dosage is still active in your body. Okay. So when I give you a drug, it's going to take a little while to kick in, and then it's going to reach its peak, right? And then start to drift back off. So for instance, if you have a very bad pain and we give you a pain medication, well, if it's a pill, depending on how it's given, it takes a little minute for it to get active. And once it gets active, it reaches its peak, you have no more pain. But as it starts to wear off, the pain starts gingerly coming back, right? Well, half-life is the length of time when half the dosage is still active in the body. So if at least half of it is still in there, then however long that is the half-life. So you want a drug that has a very high half-life. You don't want a drug that only has like a 1 hour half-life. You like I take it and an hour later, I got to take it again. It's like it's gone. You want something that has a half-life of a longer period of time, a long-acting, for instance, a long-acting bronchodilator, right? Something that I can open up my lungs and I know I'm gonna be open for 12 hours. That's what we want, right? But you got to be careful because some of those long-acting bronchodilators are not, I want to say, let's see, make sure I say this right. The long-acting are not always fast-acting, okay? So we have a difference between long-acting bronchodilator and rescue bronchodilator. Albuterol works immediately, all right? If you're having an asthma attack, you pump some albuterol, we give you albuterol, it starts to take effect immediately, okay? But it doesn't last that long. It may last 4 hours, 6 hours, okay? But if I give you salmeterol, which is a long-acting bronchodilator, it might take 20 minutes for it to kick in, right? That's not a rescue drug. If I can't breathe, I need it to work now, okay? And so if I give you salmeterol, which is a long-acting bronchodilator, it may last for 12 hours or 16 hours, but it's going to take 10 minutes, 20 minutes for it to even kick in. And so that's why we call that a non-rescue agent, right? When you can't breathe, you need to breathe now. You don't want to wait 20 minutes for a medicine to kick in, okay? So that's half-life. Number 3, tolerance. Tolerance. That's a condition in which the dose of a drug must be increased to obtain the desired effect, okay? So same thing, if you're working on that, talking about that pain medicine, you can take pain medicine, you might have started taking that pain medicine on Monday and it was working fine, and then by next Monday, you got to take 2, right? And then the next Monday, you find yourself taking 3, right? Because you're trying to chase that same feeling, right? Drug addicts, when they first do drugs, that first meth or that first cocaine or whatever it is, marijuana, that first time they ever get high is what they're chasing because their tolerance grows immediately, okay? So you never, the second time they do it, they don't get the same feeling. So they end up trying to do a little bit more. The second, the third, the fourth, they always trying to get the first feeling they got when they first did it because their tolerance has built up, okay? The tolerance. So a lot of them overdose. You got so many overdoses, not only because people are lacing it with fentanyl, but They're trying to get the same feeling, right? They can't get that. The heroin addicts are trying to get that same high that they got the first time they did it. So they do more and more and more until it kills them, okay? Until it kills them. All right, number 4, additive effects. The additive effects, and you will have vocabulary words on this test, so make sure you know these vocabulary words. Additive effects, the effect of 2 chemicals acting simultaneously at the same time, is the simple sum of the effects that they would have if acting alone. Okay, so additive effects is the effect of 2 chemicals acting at the same time, is the simple sum of the effects that they would have if acting alone. Okay, so when 2 drugs are working together in the body, it's the simple sum of if one of them was acting alone. Okay, you got to have this one and then plus this one. These are the additive effects that make it, you do them together, they work better. Okay, so these are close. These terms are very close, so make sure you study them, read about them, so you can get a good understanding in the difference between additive effect, potentiation, and synergism. Okay, potentiation is the action of 2 drugs in which the total effects are greater than the sum of the independent effects, right? So I can give you this drug and I can give you this other drug together, but if I give it to it at the same time, it's much better effect than if I gave you one by itself, okay? So for instance, when they do pain medicine, they always mix pain medicine with what?
Like a Tylenol or something.
Like Tylenol, yeah, Tylenol. It's all acetaminophen, right? Acetaminophen. So when you get a Percocet or oxycodone, stuff like that, that's pure drug, okay? Oxycodone is a Percocet, right? That's the generic name for Percocet, but it's pure drug, and that oxycodone will work, but it works better if they add acetaminophen to it. Okay, so that's usually why it says oxycodone 10 milligrams / 325. So it's 10 milligrams of oxycodone mixed with 325 milligrams of Tylenol or acetaminophen, right? Acetaminophen, because the 2 acting together give you a better pain relief than just one of them acting alone, especially if it's just the Tylenol alone, right? So that's potentiation. Potentiation. All right, synergism. Synergism. This is action of 2 drugs producing an effect that neither could produce alone, or one is greater than the total of the effects of each drug. So it's like you gotta have this mix. If I have this right mix, then I can get this effect. But if I pull the ingredients out alone, none of the ingredients can produce this effect without the other. Okay, it's like one has to be with the other, all right, in order for it to work. Okay, Tylenol and oxycodone, they both can work on their own. It might not be the best, but they both can work on their own, right? But for other drugs, and I don't have an example of a good synergism example, but synergism is when it's saying that if I don't have the perfect mixture, then it ain't gonna work. All right, that's why they always say something about this. Have you ever heard of the synergistic effect when you were in school, when they were telling you don't be drinking and doing drugs and all of that? Because you can get the synergistic effect. That means mixing drugs, like you taking weed and heroin, or you taking X pills and smoking and drinking. When you're mixing all these drugs together, it can give you an effect that none of them could have given you alone and can kill you. Okay, so you have to be careful when you're partaking. All right. Also, synergism is saying the presence of one chemical enhances the effects of the second chemical, right? So I got one, but hey, if I add this other drug to it, it gives me a total different effect, right? It makes it even stronger. All right, so I told you these terms are really closely related. It could almost be one, could almost be the other, right? But you just have to read them and study them. Now, let's not forget, let me go ahead and say, pharmacology is chapter want to say 39. Let me find it.
36.
36. In the book, Egan's book, guys, Airway Pharmacology is chapter 36. Make sure you're in your book, reading, highlighting, and all of that. It explains the synergistic, the sympathomimetic drugs. It talks about the sympathetic nervous system, talks about the parasympathetic nervous system, all of the information you could possibly desire, right, and more in the Airway Pharmacology chapter. Make sure you are looking at it. Lets you know how viruses work, how all this different stuff works, these medicines work in your body. So make sure you're doing your reading. All right, number 7. We're going to do these 12 and we'll take a break. Number 7 is tachyphylaxis. Tachyphylaxis. Tachyphylaxis is rapidly developing tolerance. So not only do, and then this is not like, I had to take two Tylenols and it knocked my pain right out. And then next week I'm taking it for a couple of weeks. And then the next week I had to take 3. Tachyphylaxis, that's just tolerance, building up a rapid tolerance. I mean, not rapid, but building up a tolerance, period. Just regular tolerance. Tachyphylaxis is if I take 2 Tylenols at 9 o'clock this morning and it worked, and then when the pain come back, I have to take 3 in the same day or the next day. I have to build up my tolerance, right? That is tachyphylaxis. Tachy means fast, right? Tachy means fast. So fast developing tolerance. You got used to that drug real quick. So now we got to give you way more just the next day or the next couple of days, right? Building really fast. All right, now let's look at some of these phases. These phases are very important. Pharmaceutical phase. What is the pharmaceutical phase? Somebody read A.
By which a drug is delivered.
The method at which a drug is delivered. So, what are the ways that we give drugs as respiratory therapists?
Through the aerosol.
Inhalation, good, aerosol. So as respiratory therapists, our pharmaceutical phase for our drugs is inhalation. All right, somebody tell me another pharmaceutical phase.
Would that be the same thing as like through the trach?
That's still inhalation. Give me another pharmaceutical phase, Ms. Thomas.
Like through an IV?
IV, intravenous. Intravenous will be a pharmaceutical phase. Ms. Rose, give me another pharmaceutical phase. Rectally, okay, rectally. Ms. Scott, give me another pharmaceutical phase.
Well, we are like said, like giving them like the pill itself, or
Orally, good. That's orally. Orally. Kayla, can you give me another one?
Do we do intramuscular?
Intramuscular, good. Shoot you in your butt cheek, right? That's intramuscular. Or your flu shots are in your shoulder. That's intramuscular. All right. And then there's one more. That's the slowest of them all.
Topical.
Topical. Topical is the slowest of them all. Okay. All right. So pharmaceutical phase is the method at which the drug is given. Now, inhalation is immediate onset of action at the desired site. Inhalation is immediate. It's not the fastest, though. What's the fastest? If inhalation is not the fastest, which one must be the fastest? Huh?
IV.
IV. Intravenous is the fastest way to pump medicine in somebody, but the inhalation is the second fastest. Inhalation is the second fastest. After the second breath, it's in there. Okay. The lungs are one of the only organs that filter all of the blood. Right. All of the blood has to go to the lungs. All of it. and come back out. And so with every beat and every breath, you have all of your blood volume going to your lungs and back to your heart, to the body. Okay. And so if you're inhaling something, it's immediately in the bloodstream, right? Immediately. Okay. That's why when people snort cocaine, it's immediate because they inhaled it. Okay. Inhaled it. It's immediate onset of action. It has reduced systemic side effects. Systemic would mean the body, right? So not necessarily bloated or nauseated, right? All those different systemic headaches and all those kind of things come from it, right? It doesn't have a lot of those systemic effects when you do inhalation, okay? Smaller doses are required because you're inhaling it right into the bloodstream, so you don't have to take a whole lot. If you're going to take the same drug orally, you have to take a little bit more because it's got to go through the digestive system and absorb and all of that, right? So you lose some of the medicine during the digestive process. Inhalation is immediate because if you take it orally, it's got to be absorbed into the intestine and all of that in order to get to the bloodstream, right? So, but the inhaler is immediately in the bloodstream, immediately, okay? And then the ability of the patient to self-administer. It's kind of hard for you to give yourself an IV, right? If you don't know what you're doing. If you're not a drug addict, then it's going to be hard. I don't stick myself with needles or intramuscular. Like some people have to give themselves a heparin shot or a glucose shot, insulin shot, stuff like that. That's hard if you don't know what to do, and it hurts, right? But you have a better ability to inhale a drug. Just give them the MDI and pump it, breathe it in, and keep on going about your business. Okay. All right. Pharmacokinetic phase. Kinetic means movement, right? All right. Pharmacokinetic phase is the time required for drug absorption, distribution, metabolization, and excretion. So that's the movement of the drug, right? You got to take it in. It's got to be absorbed. Then it moves to be distributed throughout the body. Then the body has to metabolize it, and then it's going to get rid of it. You're either going to pee it out or bowel movement it out. All right? You got to get, or sweat it out, right? Either one of the body's going to get rid of the waste. So the movement of the drug is the pharmacokinetic phase. That's the movement throughout the body. Pharmacodynamic. This is the nice one. I like this. The dynamics. What's the dynamics of the drug? The dynamics is the mechanism of action. What it does to do what it do, right? What does it do? All of this, movement and all that, but I want to know what is it going to do for me and how does it do it for me, right? That is the pharmacodynamic phase, right? The mechanism of action by which a drug causes its effect. If I have a beta-2 agonist drug, then the pharmacodynamic phase of that drug is going to my beta-2. It's going to go to my beta-2 receptor site and step on it and going to cause an effect, okay? It's going to cause an effect because an agonist is something that causes an effect, right? An agonist is something that causes effect. So if I have a beta-2 agonist drug, I have a drug that's going to go step on what? I can't hear you.
The beta?
The beta-2. Beta-2. If I have a beta-2 agonist drug, because agonist means it's going to go, it's going to cause an action. All right? It's going to trigger a response. Somebody who getting on your nerves all the time is an agonist to you. They're always getting on your nerves. As soon as they come around, they trigger a response in you. That's an agonist, right? And so if I have a drug that is a beta-2 agonist drug, it's a drug that's going to go step on the beta-2 receptor. And who remembers what the beta-2 receptor does? Does anybody remember? I said it this morning. Beta-2 receptor causes what?
Bronchodilation.
Bronchodilation. Bronchodilation. So I want a beta-2 agonist drug, right? If somebody has a bronchoconstriction, I'm looking for a beta-2 agonist drug because that beta-2 agonist drug is going to go step on the beta-2 receptor site. So agonist is a substance or drug, right, that binds to a receptor and triggers a response. And finally, an antagonist. An antagonist is a substance that binds to a receptor but fails to activate a receptor, right? It actually blocks it. So an antagonist blocks, okay? It blocks. So an antagonist, so let's look at it right quick before we take a break. Say you are, I hope everybody's paying attention. Say you are sitting in the house and there's somebody who comes, gets on your nerves every single day. Every time they come to your face, they get on your nerves. They are your agonist. Well, say you have a spouse there today, right, who's standing in front of you. And here comes the agonist. What is your spouse going to do to the agonist?
Put them out.
Put them out, right? Or just protect you, right? They're going to block them from harming you. If an agonist always comes and gets on your nerves, well, your spouse is going to keep them from getting on your nerves, right? They're going to block them. That's what an antagonist does. It blocks the receptor site, okay? So in this case, why would I want an antagonist drug? Well, if I know that a drug will cause a certain problem, right, then I want to find a drug that will block that problem from happening, okay? So that's what I talk about when I say when we get to the parasympathetic side. The effect of acetylcholine on the parasympathetic nervous system side will cause bronchoconstriction. And if I know that acetylcholine can cause bronchoconstriction, then I want a drug that's an anti-cholinergic. It's also an antagonist to acetylcholine. It will block acetylcholine from bothering me. Okay? That's how we're getting deep into what these drugs are doing. But it's not that deep if you think about it. Just kind of let it register. It's either going to cause a problem or it's going to stop a problem. All right? And you just got to come to grips with the terms and be able to align the terms with the correct drugs or with the correct terminology and what's going on in your mind, and you got it. Okay? It's not a problem. All right, so it's not, yeah, go ahead.
Could you repeat that example with the acetylcholine one more time?
Yeah, acetylcholine is the neurotransmitter or the bus driver for the parasympathetic side. On the parasympathetic side, acetylcholine causes pupil constriction, it causes bronchoconstriction, it causes a heart rate to drop. All of those things happen when acetylcholine comes around, okay? And so if somebody's having an asthma attack or is suffering from the effects of acetylcholine, then I'm going to find some kind of drug that's going to block the effects of acetylcholine. That way, when acetylcholine comes, he can't cause any problem because I'm blocking him, okay? And so if I take a drug that's going to block acetylcholine, that will be an anti-cholinergic, okay? Because acetylcholine doing his thing is called cholinergic response, okay? The cholinergic response is when acetylcholine comes on the scene and causes problems, okay? And so if I don't want acetylcholine to come cause a problem for me, I want to block him with an antagonist drug. So that antagonist drug will be an AKA an anti-cholinergic, okay? Because it's going to block the effects of acetylcholine, right? Now the notes are going to lay out parasympathetic and nervous and sympathetic when we come back from break. I just wanted to get that in you right now to understand, okay? It is 9:15. Let's take a break till come back at 9:30. Come back at 9. I'm gonna pause the recording to 9:30, and we're going to keep on with prescription requirements, and then we're going to knock out the drug dose calculations, and that's going to do it for today. You're going to have a great weekend. Okay, come back at 9:30, and we're going to talk about prescription requirements and then routes of administration, which you already told me, right? But we're going to make sure we know them in order of fastest to slowest, and then concentrations. And this is when I'm going to do the McCarthy concentration trick, and that's going to take a little minute. It ain't going to be a 2-minute thing, okay? It's going to take a little minute, but then we're going to be done for the day after that. Have a good weekend. All right, see you back at 9:30. So I'm telling you guys now, we're back from break. I'm going to show a video from the respiratory zone, which is the Airway Pharmacology, right? Airway Pharmacology. If you go to YouTube and type in respiratory zone, then that's that YouTube page I told you that this gentleman comes exactly from the Egan's book. And he helps students learn all the way through respiratory program. He gives sample TMZ questions, which you have to pass the TMZ before you can graduate and then go take the board exam, right? So if you subscribe to his page, I'm not saying you have to, but if you do, he'll send you practice TMZ questions every day, right? You can get different practice questions when you get to 240 and 250 and start preparing for that exam. So you just go to his page and you can type in his search bar, Airway Pharmacology or aerosol humidity or ABGs, whatever that we're doing. And he has a nice, little colorful, cartoonish type of stuff to help you learn. All right. He's not me. I'm just playing. But you know, you still can use somebody else's way of teaching may help you better than mine. Okay. So I'm going to pause the recording again, show the video, then we'll resume with the lecture and the drug dose calculations. And so if you're at home watching this, then you need to go to that and watch it for yourself because I can't add it to the recording. All right. So that's the video. Go back and watch it. The one that I just told you. Go back and watch it. Got some good little information to help you get ready for what you're about to learn. All right. All right. Got a message. Hold on. Step away. Okay. No problem. All right. Thank you. Just tell me to step away. All right. All right. So let's go back to the lesson plan. All right. Prescription requirements. There are some certain requirements that's got to be on the prescription. Patient name, drug name, dosage, frequency, route of administration, which would be the, what is the term for route for administration? What is the term that means the route of administration? Term that we just learned.
The pharmaceutical phase?
Pharmaceutical phase. So you must have the patient name, drug name, dose, frequency, and pharmaceutical phase, aka route of administration. Okay, that's why you got to know these terms. All right, now before giving the drug, now look, what about the doctor's name? I'm sorry. You also need to make sure you have that the physician's name on the drug, okay, the prescription. Physician's name. Let me put that in here. Patient name / doctor's name. Doctor name needs to be on there. I don't know how they got that out. What about the pharmacist's name? Does the pharmacist's name have to be on the prescription?
No.
No. Pharmacist's name don't have to be on there. I care less who the pharmacist is. Not on the prescription. Now, on the drug, the actual prescription that you get back from the pharmacy must have, they do have to be signed off if it's a certain type of drug, right? If it's a pain medication or some kind of class 1 drug, the physician does have, not physician, but the pharmacist does have to sign off on the amount that's in the bottle, right? All right, so that what has to be on the prescription for it to be valid. If they don't have this stuff on the prescription, you're not going to get it filled. If you take a prescription without the doctor's signature or name on it, it's not going to get filled at Walgreens or nowhere else. They're going to hand it right back to you, okay? They can't guess on how often you should do it or how you're supposed to get it. They don't want to guess that. They want to give you exactly how the doctor ordered it. Now, before you give a drug, always check the chart. Check the chart. You need to wake up in the morning, and every time you wake up in the morning, you need to say, check the chart, okay? That is something that you always must do. You cannot forget that in respiratory. You cannot forget that in the hospital field, period. Dealing with different patients, you always check the chart. Because if you get to working around protocols and then you never check the chart, and that's always going to come back and slap you in your face. Well, who told you to do that? Well, I didn't see it on my little work list. Did you check the chart? Because as respiratory therapists, guys, we get a little worksheet, right? When I pass on Mr. Johnson to you from last night, say I had him last night, and I pass him on to you, I'm gonna have a written report, right? I'm gonna have my little report that I write, and we also have like any changes I made that night before you get here in the morning. I'm gonna go to the spreadsheet on the computer and go to Mr. Johnson's page. He's no longer on 40%. He's now on 50%, or you know, he's done with his weaning for the day. Start his weaning today. Little stuff like that. He's on Q6 albuterol, Q12 tobramycin, right? I might have that on my sheet, our little respiratory sheet, but that ain't a legal document. That respiratory workload sheet that you get from your fellow co-worker, that's not a legal document. Okay, so you can't say, well, you didn't get a patient albuterol all day. He was supposed to get it every 4 hours. You didn't give it to him because the person before you forgot to put it back on there or whatever, right? And you say, well, it wasn't on my sheet. The lawyers love for you to say that because that ain't the chart. That is not a legal document. You will be held accountable if something happened to that patient. So say he has a bronchospasm, goes into a status asthmaticus, and dies. And everybody, well, this man been having asthma all his life. He's 60 years old. He's had severe asthma all his life. He came to the hospital and y'all wasn't giving him his albuterol for the last 2-3 days because nobody checked the what? Chart. Okay? That cannot happen. Now, we got checks and balances now that help prevent that, because when you start coming to his MAR, it's going to show you, hey, nobody gave his albuterol. Who's going to give it? And you're like, well, damn, I didn't know he got albuterol. Then you go check the chart. You might can catch yourself. But what if he doesn't have any other treatments, right? He might not have any other medicines that you give, so you don't have a reason to check the chart. And if the MAR, and if the nurse is giving medicine and seeing that you're missing your medicines, a good nurse will say, hey, are you going to get this respiratory medicine that's on the chart? You're like, what respiratory medicine? I don't have that on my sheet, right? Your sheet is not a legal document. Always check the chart. Now, some nurses care about their medicine and damn yours. If you don't give it, that's on you, okay? So always check the chart. You might not get that backing. You might not get that reminder or heads up from the nurse, okay? All right. So check the chart. That's important. You have to check the patient's name band. Make sure the patient didn't switch out on you. You never know. Sometimes, not now it's because of COVID, but before COVID, you had family coming to the hospital, right? So if you got somebody been in the hospital for a week or whatever, sometimes they use their regular clothes. They might have a t-shirt and shorts on or something, not necessarily boots or nothing, but they don't always wear the hospital gown all the time. And also, they don't like to lay in the bed 24 hours a day. So what if husband comes, right? You got your patients in the bed or a sister's there, like it was Miss Jackson, and she's been there for about 2 weeks now, right, for getting IV therapy. And she's not really sick, but she has some IV antibiotic therapy that may take a month to fuse, right? In long-term facilities, you have patients who are getting IVs or antibiotics for months. Okay, you can't get it at home. It has to be an IV, and it has to be hooked up for at least 4 weeks in order to kill whatever drug germ they have. There's some bad stuff out there, guys. That's why you need to wash your hands, because you never know what you might take in. But anyway, so Miss Jackson been in the bed for 2 weeks straight. She good. She's sitting in a chair now watching TV, and her sister came to the hospital, and she got up in the bed and kind of laid across the bed watching TV, just visiting. And here you come in the room about to give some medicine. You don't check the wristband, right? They look just alike. You don't know her from Adam, right, or Eve. And you go and give the wrong patient the drug. So the sister just looking at you while you in there setting up your little breathing treatment, small volume nebulizer, squirt your little medicine in the cup, and go hand it to them, right? That's a lawsuit waiting to happen. If you would check that, you don't have to know her. It ain't your fault that she switched up on you. You didn't know they switched up. But if you check that wristband, then you won't make that mistake. So you must check the patient's name band, okay? Always check your medication labels. Make sure they're not expired, Okay, make sure you're giving the right medicine. Some of the packaging looks the same, right? Some of the words are close to the same. So you got to make sure you're giving the correct medicine. So check the label, make sure it's not expired. If you give some expired medicine and you happen to leave that paper in the room and the family members see that paper and see that it expired last year, that's a lawsuit. They waiting on stuff like that, okay? Sometimes family members film you when you come in, right? Make sure you're doing all these steps. Make sure you're treating mama right, right? Or asking you questions. You have some family members who have a legal pad. They're sitting there every time somebody come in the room. Who are you? All right, they write your name, the time you came in, and what you did, right? And just to keep good records for their family members. You can call them being a buttholes, but at the same time, I'd rather have a family who does that than a family who could care less. Because we as medical professionals, always remember, I don't care how good you are, how much you love the patient, you know who you can cut corners with and you know who you can't cut corners with, okay? You know that in room 206, I can kind of be a little lax because nobody comes to see him. Nobody's in there asking questions. Nobody calls. I'm going to do what I'm supposed to do now. I'm going to take care of him. But if I need to cut a little corners or miss a treatment here or there, I'll do it, okay, with him. But for 409, I can't do that because the family's in there. They call every day. They want to know what's going on, right? So you know where you can cut corners. So make sure you're doing that, all right? Because family members are looking for you to cut corners. So be careful. Look at the dosage and look at the previous response. If it said he got real jittery last time, you might not want to give it this time. You might want to contact the physician and say, look, can we switch medicines to an alternative medicine, right? Because he had a bad reaction. Always check that, because if you did and you go in there and you don't check it and you give it to him again, now he got to go through that again. And he may not can verbally tell you that, right? So you need to check that response in the chart from the last therapist. What happened last time I gave him this medicine? All right. Let's look at the routes of administration. Fastest to slowest. Fastest is IV, intravenous. Number 2, inhaled, aerosol to the lungs. Number 3, IM is intramuscular. Number 4 is sub-Q, under the skin, right up under the skin, like that TB skin test is sub-Q, all right? Sublingual or rectal absorption. So sublingual is if I put the pill under my tongue and let it dissolve, right? Or if I stick it in my rectum. Notice how that's faster than taking a pill, right? Oral will be swallowing the pill. Sublingual is just putting it under your tongue, right? Rectal is sticking it up your rectum. So notice that that is faster than orally. So if you put medicine up in your rectum, you'll get it faster than if you put it in your mouth and swallowed it, okay? So that's faster. And then finally, topical, right? Topical, putting something on your skin, hoping it's gonna work. Like I see those commercials about that Bengay or whatever that stuff is, they spray it on your knee and it's gonna help. Man, by the time my wife has lupus in her joints. And so by the time I better not come in the room with no spray can talking about put this on your knee. Okay, because that'll be forever. She'll throw that can back at me. That's not gonna work. Topical is very, very slow. It takes forever. Okay. All right, here we go. Drug dose concentrations. Now, if you want to look at this right here and then say, well, now I'd rather do it this way, then feel free. I'm going to put it right here so you can see it. I'm going to pull it so you can pause it. Let me pull up a little bit more. This is the second part of it. All right. This is the ratios part. And this part. And this part. All right. Now, let me go back
I
over
need
here.
to write this down because it's not in our notes.
What? Well, I'm just showing you. What I'm showing you.
I'm asking.
No, what I'm saying is, if you can go back and look at this video and write all this down if you want to, I'm about to give you the exact thing I just showed you in a much simpler trick so that you have drug dose calculations down pat without all of this. Okay?
Okay.
If you want to, though, that's why I showed it and I'm recording it So if you want to go back and look at this and do it this way, you can. Just like those ABGs. Remember in the ABG notes, they had all of that different ways to learn ABGs. And if you want to do that, you could, but I gave you the easier way. Okay. All right. So let me do that. I'm going to stop the share at this point, and we're going to get on the board. Okay. Get up on the board and show. Now you guys, if you want to, you can pull up this right here. Let me show you this. This should be in your module right here. Mr. McCarthy's drug dose calculation shortcut. So all that I just showed you is this right here. This 2 pages. This and this. All of that, what I just showed you is this right here. Much better, much easier. You can thank me later. Now, you should have this, it's in the module. Okay, this right here is in the module. All right, so you can look at that, but I'm going to get on the board and go over some things that you can copy from the board. And then you can always go back and reference this page right here that I made up for you, okay? All right, turn the light on. All right. Mr. McCarthy's drug dose calculations trick. We'll go next door and see if he has my black marker. All right, go what we got. All right, so the drug dose calculations trick, guys, makes it so much easier. We're going to be talking about how we can know milligrams and cc's and milliliters and percent solutions and all of that. So let's do one thing at a time. As I do this, is what you need to be writing down and taking this note. All right. First thing is this. Drugs come in percent solutions. Okay. The strength of the drug is either in a percent solution or a ratio. Okay. It's either going to be given as a percent solution or a ratio. Okay. You have to take that percent solution or ratio and turn it into milligrams. I'm going to show you how to do that. All right, so percent solutions. All right, you got 0.5%. Now let me show you this. Percent solutions to milligrams, right? You have to multiply by 10. To turn percent solutions into milligrams, you have to multiply by 10. So 0.5% solution will be a 5 milligrams. You're just moving a decimal over one place. 5 milligrams. A 5% solution will be how many milligrams?
50.
50 milligrams. That's the example. Whatever you get, I don't care. So if it's a 9% solution, it's 90 milligrams. If it's a 0.05% solution, what would that be?
0.5.
0.5 milligrams. Just multiply it by 10, guys. So percent solution, we're talking about concentrations right now. These are, we're talking about concentration. You got percent solutions. This is how you turn percent solution into milligrams. You're going to find out why I got to turn it to milligrams. You're going to find out in a minute. But I'm going to make sure you got this because I'm going to erase this so I can do the next. The next one will be ratio. Remember I said it's either in percent solution or ratio. So percent solution to milligrams is multiplied by 10. Okay? So 0.5% solution will be 5 milligrams. 5% solution will be 50 milligrams. A 9%, 90. 0.05% will be 0.5 milligrams. And so on, whatever they tell you. All right. I didn't mean to erase the concentration, but I'll write it back. All right, the next concentration might be written as a ratio. You have to take the ratio, turn it into a percent solution, and then turn it into a milligrams. So let's find out what the ratios are. You may have a 1 to 100 ratio or a 1 to 200 ratio. Okay. All right. A 1 to 100 ratio is 1%, which would be what?
10.
10 milligrams. And a 1 to 200 ratio will be 0.5%, which will be how many milligrams?
5.
5. Because I already told you how to do percent to milligram, you multiply by 10. Well, the ratios is this. The ratios. A 1 to 100 ratio is a 1% solution. A 1 to 200 ratio is a 0.5% solution. Okay? Percent solution. Then I take that percent and convert it to my milligrams. Okay? These are the only two ratios you're going to see. That's it. Just them two. All right, erase that. All right, now let's get into the formula. How do we make it do what it does? All right, this is the formula. The formula is milligrams over milliliters equals milligrams over milliliters. This is the formula. Okay? Now, what does this represent? This formula represents this right here. Concentration over concentration, which is mg, over 1 ml, always. Concentration over 1 equals desired milligrams over desired ml, amount. That's what that represents. Milligram over milliliters equals milligram over milliliters. And that formula, guys, is represented this way. The concentration of the drug over 1, always. Concentration over 1. Concentration in milligrams over 1 milliliter. Okay, when I put 1 milliliter. Now, remember, milliliters equals cc's. Same thing. I may say cc's, I may say milliliters. They may say cc, milliliter, tomato. It's the same thing, okay? Milliliters and cc's are the same thing. Remember, we talk about tidal volume. Tidal volume, normal tidal volume is about 500 milliliters or 500 cc's. Same thing, okay? All right. So now, desired milligrams over desired mLs. In this case, you have to solve for X. One of these is going to be empty. They're asking for. Either the doctor wants to know how strong the medicine is going to be, or how many milligrams is the medicine going to be, or how many milligrams he wants to give, or the question is going to be asking how many mLs do I need, or how many mLs do I use to get that desired milligram, okay? Whichever one you don't know, you solve for X, okay? Very, very simple. All right, so I'm going to take this one off and leave this up, and we're going to work a couple. All right, the question is, you have 2 cc's of a 5% solution. How many milligrams do you have? That's the question. You have 2 cc's. So look, you put an X what you don't know and put the numbers of what you do know in the problem. Okay? Concentration is always over 1, and it's on this side, and that's the first thing you do. But first, let's read the question, one thing at a time. You have 2 cc's of a 5% solution. So that's like saying I have a syringe in my hand, right? I have a syringe that has 2 cc's of a 5% solution. I don't know if the doctor say, well, how many milligrams is that? How many milligrams are you about to give? I don't know, right? I know I got 2 cc's. Well, now you're about to find out how many milligrams that is and how to find out. Okay, first thing first, always find the concentration. So number 1, find concentration. That's number 1. So look at my problem. What is the concentration of this problem?
5%.
5%. It's a 5% solution. Okay? So concentration has to be written in milligrams. So what is 5% in milligrams?
50.
50. All right, so 50 milligrams over what?
1.
1. 50 milligrams for every cc. Okay? Equals. All right, let's figure it out. Now, what do we know? We have 2 cc's, so where do I put the 2?
Desired milliliters.
In the milligram. Where do I put the 2 cc's?
The milliliters.
Milliliters. 2 cc's is an amount. So I know I have 2 cc's, so I already know this. So let me put the 2 right here, 2 mLs. And so what is the question asking?
For desired
The
milligrams.
For the milligram. So I put an X where?
Above
top
the
of the
2.
X. X for milligram. All right. So 1 times X is X equals 50 times 2 is what?
100.
100. So 100. Now, where was my X? What unit is my X at? Milligrams or milliliters? How much? What is it?
Milligrams.
Milligrams. So the answer is what?
100 milligrams.
100 milligrams. I have 2 cc's of a 5% solution. How many milligrams do I have? Well, this says I have the concentration is 50 milligrams for every ml. So if I got 2 mLs, I have 100 milligrams. But if I don't work it that fast, I can just fill it out in the formula. 50 milligrams over 1 equals, the question says, how many milligrams do I have? So I got to put an X for milligrams, right? I have to put an X for milligrams. Okay. And I already know I got 2 cc's in my hand. I have 2 cc's, so let me put my 2 there because I know I have that. So I'll just multiply. 1x, 50 times 2 is 100, and the X is over the milligrams. So I have to put milligrams right there. The answer is 100 milligrams. All right, let's do another. All right. Take a couple and you'll have it, I promise you. Well, I got that. And that's it. That's hard as it gets. All right. And you got to make sure you understand what the problem is asking. Don't put the wrong stuff in the wrong place, right? All right, so now let's look at this. You have 50 milligrams of medicine. $50 milligrams of medicine of a 0.5% solution. How many milliliters do you have in your cup? So you got a breathing treatment, you know, you got your little breathing treatment, small volume nebulizer, and you have, you know, somebody told you it's 50 milligrams of medicine in this cup, and it's a 0.5% solution. So how many milliliters are in that cup? How much is actually in there? Okay, we do the same thing. Concentration, which is in milligrams over 1 ml, equals milligrams over milliliters. So what is the concentration of this drug? Let's say Miss Scott. You with me, Miss Scott?
Yes.
Okay, what is the concentration? Always find the concentration. That's the first thing you do. Find the concentration and put it over 1. What is the concentration of this problem?
50 milligrams.
No, that's how much I have. That's how much drug I have. What's the concentration? Remember, concentration is either ratio or percent. So what is the concentration solution?
0.5.
0.5%, right? So what is that right here in milligrams? What is 0.5% in milligrams?
5.
Ms. Scott.
Is it 5?
5, because 0.5 times 10. Remember, to go from percent to milligrams, you multiply by 10, right? So 0.5 times 10 is 5. So you have 5 milligrams over 1 cc. What this is saying is you have 5 milligrams of medicine for every cc you have, okay? Now, equals, now let's see what else we got here. I know that I have 50 milligrams, and I want to know how many cc's are actually in the cup. So, Ms. Scott, where do I put the 50 milligrams?
At the desired milligram.
Yeah, right at the top, because I know I have it. They already told me I got 50 milligrams. So I put the 50 right there, right? What I don't know is how many milliliters are in the cup. So where do I put the X, Ms. Scott?
At the desired milliliters at the bottom.
There you go. So let's solve for it to find out how many milliliters do I have in my cup. X times 5 is what, Ms. Scott?
250.
No, let's do one at a time.
Oh, sorry.
X times 5.
5x.
5x equals 50 times 1 is what?
50.
50. All right, divide both sides by 5. And x equals what, Ms. Scott?
10.
10. All right, now where is my x? Under the milliliters or the milligrams?
Under the milliliters.
Milliliters. So I have to put milliliters right here. So what's the answer? How many milliliters are in that cup?
Yeah.
10. 10 milliliters. And if I want to check my work, then I could put the 10 right here, right? I could just put the 10 right here back in and solve, you know, to see if my answer was right. So if I put a 10 right here, that'd be 10 times 5 equals what? 10 times 5 will be 50, right? 10 times 5 will be 50 equals 50 times 1 is what? 50. So I'm right. All right? So the question says, I have 50 milligrams of medicine in a 0.5% solution. How many milliliters do I have in the cup? First thing first, always find the concentration first. And the concentration will always be the percent solution or the ratio of the solution. Okay? Find that in your problem and stick it over 1. But you need to make sure it's in milligrams. Okay? Then you find out, what are they looking for? What do I have and what am I looking for? Whatever I know that I have, I stick it there. And whatever I'm looking for, I put an X there. And that's it. So let's do a ratio.
You said the concentration would always be a percent in what?
Concentration of the problem will either be a percent solution or a ratio. Okay? Concentrations will only be a percent solution or a ratio. That's the only two concentrations the way it comes. That's the only two concentrations you ever have. It's either a percent solution or it's in a ratio form. But either way, you got to get it to milligrams before you work the problem. Okay? And I showed you that to go from percent solution to milligrams, you multiply by 10. And then I showed you what the ratios were. I said a 1 to 100 was a 1% solution, and a 1 to 200 would be a 0.5% solution. And that's the only two ratios you're going to have. All right. What about this one? The doctor orders 10 milligrams of a drug that comes in a ratio of 1 to 100. Okay? How many milliliters do you need? The doctor orders 10 milligrams, that's what he desires, of a drug. But that drug comes in a ratio of 1 to 100 solution. How many mLs do I need to satisfy this order? All right. Milligrams over 1 ml equals milligrams over milliliters. All right, Ms. Renfro. What is the ratio? What is the solution, the concentration of this drug?
%.
Okay, yeah. So ratio will be 1%. Good. Now, in milligrams, what do I put right here? 1% is how many milligrams?
10.
10 milligrams. Because a ratio of 1 to 100 is a 1% solution. And the ratio of a 1 to 200 is a 0.5% solution. So since she knows that the ratio of 1 to 100 is a 1% solution, in order to get to milligrams, I have to multiply by 10. So 1 times 10 is 10 milligrams over 1 ml. Now, the doctor orders 10 milligrams of that drug, and I want to know how many mLs do I need? Well, it's obvious now, but let's work it out. So, Ms. Renfro, what goes where?
10 milligrams goes where the desired milligrams is.
That's what he wants. He ordered 10 milligrams of this drug. Now, so what goes on the mLs?
X.
X. All right, so let's solve it. X times 10, Ms. Renfro, is what?
10x.
10x equals 10 times 1 is what?
10.
10. Divide both sides by 10, and x equals
1.
And what's the suffix? What's the unit of measure?
Milliliters.
So the answer is 1 milliliter. And before I even did all of that, once I found out that this drug is 10 milligrams for every cc, and all he wants is 10 milligrams, well, all I need is 1 cc. Everybody understand that?
Yes.
But you know, in order to just,
Yes.
for practice sake, just go ahead and work it out, okay? Because, you know, once I found that out, I said, oh, all I need is 1, because the concentration is whatever milligrams for every cc. All right, so if in this case, it's 10 milligrams for 1 cc. If I had 2 cc's, how many milligrams would I have?
20.
20. If I had 3 milliliters, how many milligrams would I have?
30.
30. Because in this case, it's 10 milligrams for every cc. So if I have 1 cc, that's 10 milligrams. If I have 2 cc's, that's 20 milligrams. If I have 3 cc's, that's 30 milligrams, right? In this case, I could have stopped right there, but for practice sake, go ahead and work it out, okay? You do the math and you come up with 1 ml. So when the doctor orders this, I know when I work this out in my head right quick, I'm gonna pull 1 ml out of that bottle and give it to the patient. Okay? That's it. You thought it was gonna be much harder than that. And it's not. It's not. All right, the trick is putting the right number in the right spot. All right, now they also give you a little fluff, okay? They also give us what we call fluff, where some extra numbers thrown in the problem to throw you off. For instance, sometimes you have a sometimes you have what's called a stock bottle of medicine. Sometimes the medicine is not in the little vial. Sometimes it's a big old glass bottle, and you have to pull out of the stock bottle. Okay? This is called a stock bottle of medicine. So let's just say this is Albuterol. You have instead of the little vials, y'all don't have the vials today, you got a big stock bottle, right? And you have to stick your syringe down in the bottle and pull your amount that you need up out of there, okay? So this is the problem. You have a stock bottle. Matter of fact, let me put the number in there. You have a 1,000 milliliter stock bottle of albuterol. Okay? The bottle is a 3% solution. The doctor orders 20 milligrams of this drug. How many milliliters do you need? Scoot it up so you can see it good. Don't let it trick you. Follow the directions. You have a 1,000 milliliter stock bottle of albuterol. The bottle is a 3% solution. The doctor orders 20 milligrams of this drug to be given. How many mLs do I need? All right, Miss Rose, you with me?
Yes.
Okay. Okay, Ms. Rose, what is the concentration? I don't care what is going on. What's the concentration? Of the, well, yeah, you're right, but let's do one at a time. What is the concentration in the problem?
3%.
3%. So 3% is the concentration. All right? So 3% is how many milligrams?
30.
30. 30 milligrams for every cc. Okay? Now, what is the doctor asking for? What is the question? What is the question asking for? What do I not know?
The desired milliliters.
So I'll put an X right here because I want to know how many do I need. What is the doctor asking for?
20 milligrams of the drug. 20 milligrams of the drug.
20, you say 40 or 20?
20.
20, good. 20. So 20 goes right here. That's the desired milligrams. So you see that this 1,000 meant nothing. That's fluff. Some people would have put 1,000 right here. You don't put the 1,000 right here. The 1,000 just telling you got a big bottle. But all of the drug in that bottle is a 3% solution, right? And the doctor wants 20 milligrams. So I need to find out how many cc's do I pull out of that huge bottle to accomplish this order. The 1,000 means nothing. You could have a swimming pool full of medicine, right? But that swimming pool is going to be a certain percentage, right? Or ratio. It's going to be a concentration. So I may take my little needle in that whole swimming pool and pull out what I need. I don't care if it's a swimming pool or an ocean full of medicine. That's what we call fluff. Be careful for the fluff because sometimes you will have a stock bottle, okay? So I have a stock bottle. So what? It's a 3% solution, 30 milligrams over 1. The doctor wants 20 milligrams. 20 goes right there. How many mLs do I need goes right there. So let's figure out how many mLs do I pull out of this big bottle. Miss Rose, 3 times X, 30 times X is what?
30X.
30X equals 20 times 1 is what?
20.
Yeah, 20. All right, divide both sides by 30. So 20 divided by 30 is what? 20 divided by 30.
0.6.
How much?
0.6.
0.6. So 0.6 what?
Can you hear me?
Nah, barely. Every now and then.
Okay, milliliters.
Milliliters. So out of that 1,000 milliliter bottle, all I got to pull is 0.6. That's just a little more than half a liter, half a milliliter, right? All he wants is 20 milligrams. So I solve for X, and my answer is 0.6 mLs. That's how much medicine I pull into my syringe to accomplish this order. The 1,000 meant nothing. So it's just like if I said, if I got rid of that, you got a 3% solution. The doctor orders 20 milligrams of that drug. How many mLs you need? 0.6. That stock bottle, it wouldn't have mattered if I said you have 100 gallons of albuterol in a 3% solution. Wouldn't matter if I had 100 gallons. That's, who cares? This is what matters. Concentration over 1. What is the desired amount and how much do I need? Boom, 0.6 mLs. Right? You got it. Now, sometimes they might ask you to go backwards, and that's not hard. Because sometimes they say you might have all the stuff, but the concentration. What if they want to know what is the concentration in that drug? All right, well, let's figure that out. And that's the last one. Let's figure that out. All right, make sure I write it right. Let's see here. You gave 40 milligrams of a drug in 10 cc's of medicine. Okay? You had 10 cc's and you know it was 40 milligrams. Okay? Question now is, what was the percent solution? Or what was the concentration? I want to know it in percent solution. All right. Set up my problem. Milligrams, milliliters equal milligrams over milliliters. All right. In this case, all right, concentration over 1. Do I know the concentration?
No.
No. So what goes there?
X.
X over 1. All right. I gave 40 milligrams. So what does the 40 go?
Top.
40. And how many cc's did I use?
10.
10. Now we solve for X. X times 10 is what? Huh?
X.
10x. 10x equals 40 times 1 is what?
40.
40. Divide both sides by 10. And x equals what?
40.
40 divided by 10. There you go. 4. Where is the x at?
At the top, milligrams, concentration.
Milligrams. So 4 milligrams is the concentration. How do I turn that into a percent? If I went from percent to milligrams, I multiply it by 10, then go from milligrams back to percent, I got to do what?
Divide.
Divide by 10. So 4 milligrams is how many percent?
0.4.
There you go. This is a 0.4% solution. That's the concentration. 0.4%, because 0.4% times 10 is 4 milligrams. So if they give you that, which is rare, they ask you for the concentration, you put the X. If you don't know the concentration and they ask you for it, put an X. It's still milligrams. When you solve your problem, it's going to come out in milligrams. Then you take that milligrams to go back to percent by dividing by 10, and you get 0.4%. And that is all of it. That's it. No matter how fancy they try to get with the words, this is all you have. This is much easier than what they give you in the lecture. Okay? This is it. This is the trick. And you got the trick written down on paper. So, practice it, because over the weekend, I'm going to give you some problems. Over the weekend, I want you to work these drug calculation problems. And then Monday, we're going to go over that first, and then jump right into the rest of the lecture, get into the more advanced parts of the lecture, talking about the sympathetic nervous system, parasympathetic, all that kind of stuff. Okay? All right. Excellent job. I hope you have all this stuff written down. Let me see. What's something else? Calculations. Over the weekend, I'll work on those. I want you to go through your medicine cabinet as well and start looking at your kids' Tylenol and stuff where it says, give 5 mLs, right? Give 5 mLs every whatever. And you'll say, well, now you know how strong is this medicine? How many cc's do I don't have mLs on my thing, or the doctor may say, I want you to give him 10 milligrams of amoxicillin once a day, right? Well, your medicine cup doesn't say milligrams. You got to know how many cc's to put in your cup, right? And then you got to find, so look at the drug. This amoxicillin is, what's the concentration of this amoxicillin? If it's a 0.5% amoxicillin, then I know I have 5 milligrams for every cc, right? And then I just solve it. You'll start looking through your medicine cabinet. Looking at this stuff is fun once you learn it. You have learned the good trick of how to solve and find these medication strengths. Okay, so let's look at that page right quick so everybody understands this page. This is it right here, guys. Concentration. I hope I'm recording. Oh, yeah, okay, good. Concentration over 1, right? Milligrams over cc's. Desired strength over desired amount. Percent solution is the concentration of the drug. Milligrams is the strength of the drug, and cc's is the amount of the drug. Okay, amount. All right, to convert percent to milligrams, simply multiply by 10. So for instance, percent solution that you would get, these are just two of them, it could be anything. 0.5% is 5 milligrams because 0.5 times 10 is 5 milligrams. Same thing with the 1%. A 1% solution is 1 times 10 is 10 milligrams, right? Then if I look at ratios is another concentration. A 1 to 100 ratio is a 1% solution. A 1 to 200 ratio is a 0.5% solution. You take that percent and then convert to the milligrams by doing the multiplying by 10. Okay, so steps. First, find the concentration of the problem and put it over 1. Okay, next, find out what are they asking you for. The question will either ask you how strong it is, which is the milligrams, or how much to use, which is mLs. Use an X for that value and put it in the correct place. So if you don't know, put an X for what you don't know. Okay. Put the given strength or amount in its correct place and then solve for X. Your answer will use the unit of measure that your X was placed in. Okay. Example over this side was desired strength over desired amount. So for example, how many milligrams of active ingredient are in 5 cc's of a 5% solution? All right, first thing first, find the concentration, right? So the 5% solution is 50 milligrams, right? 5 times 10 is 50, put it over 1, equals. They want to know how many milligrams of active ingredient do I have? So I put an X there. And I have 5 cc's of that medicine. So I put the 5 here. Solve for X. X equals 1. I mean, X on this side. 50 times 5 is 250. So X equals 250 milligrams. All right. So if I give 5 cc's of a 5% solution, then I'm going to give that patient 250 milligrams of medicine or active ingredient. Okay, simple, guys. Don't make it harder than it is. But if you don't look at it this weekend, then when Monday comes, you'll be like, damn, what, I forgot. It'll go from you. But if you work on it all weekend, you'll have it down packed. Because the worst thing to do is trying to know all this sympathetic nervous system, parasympathetic nervous system, all these different receptor sites, and then get hit with the drug dose calculation. That'll just be so frustrating, right? Go ahead and get this down packed out of your way. You got this under your belt, right? And then when we get to the other stuff, you can just focus on that, right? Global respiratory drug. Oh, okay. It's just a picture. This is an MDI here, squirted, and the medicine comes out, all right? So this is Mr. McCarthy's drug dose calculation shortcut. Way more user-friendly than the other one. But they talk about grams and converting grams to milligrams and all of that different stuff. It's, you know, if that's what you like, then use that, okay? By all means. If you like that, then you're feel free to use that. Like I said, I put it in, it's in there. You can look at it with no problem, okay? It's in the lesson plan. I already recorded it. This is it right here. Concentration, the weight in grams, and the solute dissolved in the volume, and all of that, right? Go through all of that to get to that 10 milligrams. 1% is a 10 milligram. We already know that, right? But all of this they doing is extra, okay? Then
So we won't have to know all of that for boards,
you already know it.
but we won't have to know like the extra stuff that's there.
No, the only thing that's there is just showing you how to find what you just found in a different way, right? A harder way. All they're going to ask you is the amount. The questions are going to give just like I just did. You have this amount and this prescription or whatever. How much do you got or how much do I need? That's the question. They could care less how you get to it. Okay? They want to know, do you know the answer? All right? Some people learn better with all this extra, so I'm leaving it there for somebody who wants to read that, and maybe that's better for them, right? I'm not gonna just take it away, but it's ultimately the same thing, okay? Ratios, here they are, okay? And how they came about their ratios, which is a lot more, okay? It's a lot more. Unnecessary. All right. So tomorrow, not tomorrow, but Monday when you come, we're going to do the mechanics of bronchodilation, talking about that nervous system, the sympathetic and the parasympathetic, and all of the drugs that go with the drugs. So you talk about receptor sites. We're going to talk about cholinergic stimulation. We're going to talk about specific. So I'm going to show you this example, and then I'm going to let you go. An example of a card or no card or a drug itself. Specific sympathomimetics, that's the drugs that mimic the sympathetic nervous system. Sympathomimetic, aka adrenergic, aka bronchodilator, right? They're all the same. Isoproterenol Hcl, that is the generic name. Isoproterenol Hcl, trade name Isoprel. Concentration, it is a 1 to 200 ratio or a 0.5% solution, okay? You don't have to know, it don't care how you get to these right here. That's what's one thing I want you to be able to do. And with the trick that I gave you is so much easier, all right? The receptor effects, alpha has 0, beta 1 is +4, beta 2 +4, okay? It is a short duration, and this is the dosage. You have to know all of this about isoproterenol, okay? Another example, isoetherine. Trade name is Bronchosol, right? Generic is isoetherine. Trade name Bronchosol. Concentration of this one is a 1 to 100 or a 1% solution. Alpha none, beta 1 +1, beta 2 +3. Duration is medium, and this is the dosage, and you cannot exceed 1 cc maximum, right? Now, you have to know all this about Bronchosol. I may give you the answer in Bronchosol, or it might be isoetherine. So you see, guys, what you're going to have to come up on next weekend. You're going to have to know how to know these medicines, all the components of the medicine, all right? And it's several of them, okay? Several of the medicines you got to know. So over the weekend, work on this. I'm about to put the homework in there for this weekend, is the drug dose calculation stuff. Some practice that, and also go over in your book, because the book has some of these medicines too. It has charts in the chapter of the book. Might have like Bronchosol and how long it lasts, and in the trade name, and all that stuff that's in the notes is in the book. Okay, so look at that over the weekend. This is pharmacology, guys. It is not planned. You got all weekend to get some good information in, studying. And then we're going to hit it hard on Monday, okay? You got this test, and you have hyperinflation test next. That's it, right? After that, you're just going to study for your final and your oral, and you're going on to 220, okay? Long road. You guys have done a good job. I'm proud of you, but don't let up off the gas. I don't care what's going on this weekend. It needs to be pharmacology, all right? Because this is a lot of information. And you're going to see it again on your oral and your final. So you can't just memorize it for this test. You got to know it. You got to know it. Okay. All right. So have a good day. I will put the homework in the assignment. In the module now, which is going to be the drug dose calculations. I believe it's in the module. Let's do that. Make sure it's in the module so you guys can see what I'm talking about. All right. So this is the. So go to modules. All right, pharmacology. Drug dose calculation quiz. I'm going to publish it now. This is what it looks like. I go to questions. Now, I don't want you to do number 7. You're listening to my voice. Don't worry about number 7 because number 7 talks about diluting with normal saline. All right? Don't worry about number 7 because you don't have any questions that talk about diluting it with saline. Okay? So don't worry about number 7. Now, you can stab at it if you want to, but don't worry about number 7 for the homework. But these are the questions here. Okay? For instance, number 1 says you have a 0.5% solution of a drug. The physician orders 20 milligrams of that drug to be given. How many cc's should I use? So you'll just set it up. 0.5% is 5 milligrams over 1 equals 20 over x. Solve for x and put your answer. Number 2, how many milligrams of active drug are in each cc of a 3% solution? Well, concentration over 1. So however many milligrams this turns out to be, it's that over 1, right? Every cc. So what would number 2's answer be?
30.
30 over 1.
30. So it's just 30 without even working that one out. It says how many milligrams of active drug are in each cc of a 3% solution. And we know to set it up is concentration over 1. So that's saying whatever the concentration per cc, right? So 3% is a 30 milligram solution over 1. So 30 milligrams in every cc. And that question saying how many milligrams in each cc? Answer is 30. Okay? So this is it. Stab at it. It's 10 of them. Now, it's got the answer key, guys. But I promise you, you don't want to look at that answer key and just say, oh, I'm just going to answer it, because it's not going to help you. Do them first. Do 1 through 10 first, and then check the answers. I'm giving you the answer key. So do your problem and check your answer. If you get it wrong, do it again and see how they got that answer, all right? And then Monday, we'll go over them. If you have one you just could not figure out, we'll go over that. But then we're going to go on to the rest of the notes, all right? So please look at your answers. Do them yourself first. Then look at the answer to match yourself. Because if you give me just the answers, I'm fine with that. I'm not, I do want you to show me your work, okay? Show me your work. Don't just give me 1 is 20, 2 is 30. You know, don't do that. I want to see your work, at least your basic setup and how you did X times this equals this, divide both sides by this, and got that. I want to see your work, but don't just, you know, put the formula and put an answer, because it's not helping you, all right? It's not helping you, all right? If you do that, I'm still going to give you credit, but it's not going to help you when it's time to know it, all right? So that is your homework for tonight. So when you get it, you're going to have to do it on a separate piece of paper, so you'll submit it to me. So I'm going to put the homework, even though this is in the module, you'll have another link that says for you to submit it, okay? It's going to say homework for 11/20/2020. Drug dose calculation quiz due by midnight. Due by midnight on Sunday night. You don't have to do it tonight. It's not due till Sunday night. All right. Everybody have a good day. You did, for those who are live and here, it's going to help a lot. Going back and trying to look at this video, if you may not have it the most. Okay. But you know, like I said, you got to do what you got to do. But this has to be your number 1 priority, at least number 2. All right, have a good day. I will see you guys on Monday morning.